What's left are generally lower income working adults, and we pay an enormous amount to not cover them. The fact of the matter is that our healthcare system is wildly inefficient, largely because we have an insurance industry that devotes enormous resources to trying to identify who really needs health insurance so as not to give it to them. And we have healthcare providers devoting enormous resources fighting with the insurance companies to actually get paid. And the result is a wildly inefficient system. It would be cheaper by far to just cover everybody. We pay this huge price because we've managed to convince ourselves, or be convinced, that somehow something that every other advanced country does and that we do of ourselves for the elderly is impossible.
Thank you. Thank you very much.
It is intuitive to think that it should, that we have the very poor and helpless people, and it's the job of government to help them. And actually, we have that. We have Medicaid. If you are poor, you are covered in America. It's not a good system. It's tempting to think that a wise government could step in, and Paul Krugman has just said, look at Medicare. People like Medicare. And that's true. But of course they like it, because it gives you stuff free. People like that. But it's unsustainable. It's $35 trillion in the hole. That's the unfunded liability of Medicare. They made promises to cover us when we're 75, when the panel is 75. There's no way they can possibly do that. Right now it's working because there are lots of young people and relatively few older people, but there's just no way it can be sustained. If a private company tried to run its pension system that way, I bet they'd throw the owners in jail. It's a Ponzi scheme. Now, some people will talk tonight about the widely publicized data that America spends the most on health care, and we do, and studies have found that we have the worst result. But those studies are deceitful. They compare us by how long we live. But Americans are different. We drive cars more. We kill each other more often. Our accident rate, deaths on the highway, is triple that of the United Kingdom. We murder each other 10 times as often as the United Kingdom. When you take that out, we live longer than those other countries. And that doesn't even include diet issues, because we eat more, and that kills people. A lot of these studies are skewed to make America look bad. Now, many people say that the perfect system is in Europe, where you have universal health care. And it's true. Most other countries do have systems like that. And it gets rid of the horrible anxiety that some people have in America. Will I be covered? And that is horrible, and that does make people sick. But it's better to be anxious than to be in horrible pain or to be dead. And these universal coverage systems, they don't guarantee universal access to actual care. In Canada, more than 1 million families can't get a doctor. We taped in one town in Ontario where they have a lottery. They have a little box. Everybody puts the family name in, and the town clerk pulls out a name. Oh, you get to see a doctor this week. There aren't enough doctors to go around. In Britain, 1 in 8 patients waits more than a year for treatment in a hospital. The journal Clinical Oncology says 20% of potentially curable lung cancer patients become incurable on the waiting list. Now, why does this happen? Well, because when everything is free, when the government pays for it, everybody wants everything. But the government doesn't have infinite money, so the government then must ration. And they do it by not giving you the latest, most expensive stuff, or they make you wait in line. In one town in England, they opened a new office where you could get dental treatment. People lined up for blocks. Now, most of them didn't get in, so people pull their own teeth. The dental tools are pliers and vodka. So it's not a good way to live. Still, despite the fact they spend less, European care is not remarkably inferior. It's pretty good for most people. But that's true only because they freeload off of us. Because most of the innovation comes from America. from the greedy, profit-driven companies that want to take as much money from you as they possibly can. They're the ones who gave us so much good stuff, the MRIs, the CT scans, ACE inhibitors to lower blood pressure, the statins like Lipitor to reduce cholesterol, coronary bypass surgery, hip replacement, knee replacement. What will the world be like if we have universal care and we don't have America to invent those things? Yes, the private market is awful in many ways and wasteful. Health insurance companies waste all this money on advertising, paperwork, duplication, claims officers trying to make sure you're not cheating them. It is intuitive to think a single payer would be more efficient. And Michael Rackless, who will speak shortly, has written that a public bureaucracy is cheaper. And I used to believe that when I attended Paul Krugman's university. I was taught that the wise elites in Washington and state capital can plan these things better than these competing companies. But then I became a consumer reporter, and I watched the market work. I watched government and private greedy companies trying to deliver services to people. And now I say that's nonsense. Government can't do anything even close to the efficient way that private companies do it. When government pays for things, people don't change. They don't innovate. They keep doing the same thing they did to get paid. So as an example, look at the inefficiency of the private car companies. They waste millions on advertising on my program. I'm glad they do. And they run these gross ads. They sell cars not based on their engineering, perfection, or safety. They sell sex and muscle cars. They have these competing dealerships and pushy salesmen selling things like rust-proofing that we don't need. Despite all of that, what's the worst you get when you buy a car in New York? I mean, the worst you can get is better than this. This is what the planned economies, universal coverage gives us. And I apologize to those of you on the radio. You can't see I'm holding up a picture of the Trabant, that East German car. This was the best those brilliant East German engineers could produce. It was an awful car. You had to put the oil and gas in separately and shake the car to mix them together. As soon as the Berlin Wall went down, this disappeared because it couldn't compete with the mediocre products that were produced by our competing companies. I don't want to have this kind of health care, and that's what we'll get if government runs it. At the beginning, government can do things well. You get the Peace Corps, New York's public schools, but after a while it deteriorates because they don't change, they don't improve. Maybe once every 12 years they change a little. If we have universal health care, this is what we'll get.
Thank you, John Stossel.
Finally, and this is the other reason to be against Medicare for All, it's going to kill innovation in the healthcare field. And everything that is good about healthcare is better now than it was 50 years ago because of innovation. It's going to stymie things in two ways. First off, do you really expect a centralized bureaucracy to decide, okay, this is a good cutting-edge way of treating illness? We're going to go ahead with that. The government and bureaucrats in the government in particular, when you have no recourse outside of that system, which is the whole point of Medicare for All, there is no outside, they're not going to be responsive, they're not going to be forward-looking, they're not going to be avant-garde when it comes to new types of healthcare. The other thing, and this goes to Bernie's idea about profit-driven insurance companies, how many of you work for a living? And how many of you work for a wage? You know, talking about stuff as profit-driven is just mere ideological cant. If you take away a drug company, if you take away a doctor's incentive to make money and to come up with new ways of doing things, which is what will happen under Medicare for All because there will be strident price controls on all sorts of activities in the healthcare space, you're going to hurt the ability to try new things and to make money from doing them. There's nothing wrong with that.
Nick, why don't you take that on? So your opponents are saying the money doesn't have to come from doctors. It will come from the bureaucracy of the private insurance companies, which now cover roughly 60% of the population.
Yeah, it's actually higher than that. The number of people who are covered through private insurance is closer to 80%, I believe. But in any case, this discussion of Medicare is great because it only charges 2%, or it only spends 2% on administrative costs. That is because Medicare is geared towards retirees who are politically the most connected and powerful constituency in America. Anytime the government goes to say, you know what, we're going to cut down on Medicare fraud and billing abuse or just mistakes, people go bananas, old people go bananas, they call their congressman and it gets stopped immediately. In Obama's chief economic advisor, Christina Romer, did a study during Obama's years in office and found that 30% of Medicare's budget could be cut without affecting medical care. There is a huge amount of waste in Medicare right now as we know it, which is already bankrupting the country. There's no incentive to look for fraud and bad billing and things like that. For private insurance, yeah, they go after waste, fraud, and abuse because they have to.
Whether or not we can cut 30% of Medicare's budget without affecting medical benefits, I can tell you we can cut 100% of private health insurance and we'd improve medical outcomes. Because the essence of private insurance is about making profit for their shareholders. And the question that you have to ask is a philosophical one. It isn't solely one about numbers and cents. It is a question of, do we want a society where the profit motive informs who lives and dies? I'm a capitalist, I'm a business person, I'm an entrepreneur. I think many things are totally suitable to the profit motive, but some things aren't. We've tried this system of a profit-oriented health insurance industry, and it's left 80 million people, disproportionately women and people of color, either uninsured or underinsured.
Joe, I mean, in terms of the profit that you're talking about the insurance companies are making, in a recent year, it was last year, the year before, they made something like $22 billion, which sounds like a lot of money.
Correct.
But the proportion of money, of the proportion of healthcare costs covered by private insurers was about $1.1 trillion. That means their profit as a percentage of all of the money being spent by them on healthcare, it's not even 2%, it's 0.02%. It sounds like that's not money that would move the needle in any significant way.
But let's keep in mind that $22 billion is the profit for shareholders. That doesn't count the tens of billions that go to executives, the tens of billions that go to unnecessary administrative work, all of which is ultimately a tax on low-income Americans who are disproportionately women and people of color. So it's a much bigger pie than just the $22 billion of profitability.
Can I just quickly say, insurance has been around as an economic instrument for centuries. It is not based on cheating people. It is based on figuring out how you can pool risks and make a profit off of it. There's nothing wrong with that. And again, I want to stress this idea. We keep saying, I think you guys are claiming that medicine somehow is a totally different, it functions totally different than other parts of the economy, or it is a good that should be held in total abeyance of all laws of supply and demand. I mean, why isn't food treated the same way as medicine by your lights? And again, I would just argue, we can deal with people who don't have enough food, we can deal with people who don't have enough health care without blowing up the entire system in a way that is going to create a place where we're all waiting for old-style medical treatment.
I have a sense in the last 10 minutes we have not heard very much from Sally. I want to give you a shot to get into this conversation.
Oh, I thought I'd been talking too much, so.
Nobody has ever said that on this stage.
Well, I mean, I have talked about the UK and about Canada and about doctors, how they're paid. The fact that my cousin graduated 4 years ago as an orthopedic surgeon. After 2 years, not one of her friends who are orthopedic surgeons was able to get a job in the province of Ontario.
So why do you think that would happen here?
That has happened because the provincial government has a cap on how many orthopedic surgeons they have. Meanwhile, you have all these people in Ontario on waiting lists to get hip replacements, shoulder replacements, knee replacements, and there are young docs waiting to do the work, and they can't work because they can't get paid because the government is the sole payer.
Well, if If the government knew anything about running a health insurance company, then Medicare would be turning a profit instead of running an $80 trillion deficit. And if the president wants to haul some people around a conference table and berate them for high premiums, he should be hauling Mitt Romney and Deval Patrick, governors of Massachusetts, around that conference table, because it's in Massachusetts where health insurance premiums are rising the fastest. And that's precisely because Massachusetts has already enacted the Obama health plan.
Erica, I'm not going to deny that Medicare provides valuable services. But,
Right.
when you say it's the most efficient, it's 30 trillion some odd in the hole. Why is that? What does that tell us? How does that inform us?
Well, Medicare is sponsored by the government, and as such, it has an obligation to cover people. Its obligation is not to make a profit. Its obligation is to provide
Well, how
health
about
care.
break even?
Whereas
Just
health
the money.
insurance
You just said
companies
it's efficient.
have an obligation
Efficient means
to develop.
break even.
The Medicare system is a very efficient healthcare delivery system. Look at any report from any economist. It is an efficient delivery of the services that it provides.
Mike Cannon, let me just go on to this. In this health care bill, there's going to be massive regulation of insurance companies, and they're going to face higher taxes. Just want to get you to comment. Yes, there's a universal mandate, but regarding insurance companies, they're going to order the benefits, they're going to dictate the benefits, they're going to regulate the prices, they're going to regulate the doctor and various services reimbursement rates, they're going to set up a bunch of boards. Essentially, it will become a government-run insurance industry, will it not?
It'll essentially be socialized through the private sector, and it's completely disingenuous for the president or other supporters of the Democrats' health legislation to say that they don't want private insurance companies coming between patients and their doctors. The Price Control Commission that the president has announced or proposed, it would tell insurance companies, no, you can't raise your premiums by 10%. You can only raise them by 5%. So when insurance companies can't cover their costs, they're going to start denying services. And the cause is going to be that government price control commission. It's a tool for enabling the government to implicitly ration care without getting their hands dirty in any of those actual medical decisions.
So you have a choice
and yet
in front of you. I mean,
they'll turn around and blame that on the insurance companies rather than on the regulations that actually cause the problem.
One of the insurance companies that's in the news right now is WellPoint, and they asked last year in Michigan for a 50% increase in premiums. So a normal individual
you know what,
who is paying maybe $8,000 a year is going to see their health care costs go up by $4,000.
You can pick out a high premium increase like that any year, any day of the year.
That's exactly right, and that's part of the problem. You can't pick out a rate increase like that any day of the year.
What you want to do is compare average premium increases state by state, and Massachusetts has the highest average premium increases for any state in the union, and that has already enacted. Massachusetts has already enacted the Obama health plan.
But don't
Erica, how do you respond to the argument, though, his original argument that if they don't raise premiums, the other option is they're just going to deny services? How do you respond to that argument? Because that seems like a pretty, I mean, that is kind of the experience that you have. If they don't raise your premium, you end up getting less coverage. It's not great, but that does seem to be the trade-off. How do you respond to that?
I think everything that you're saying is exactly right. They are denying coverage. They're raising premiums. They're denying coverage. And 45,000 people died last year because they didn't have the right kind of health insurance. Well, and again, it comes down to this question of values. Do you think that people who have worked their whole life for a living deserve to be sitting in a hospital bed and arguing with their insurance company?
Larry and Trish, may I add one thing?
I just want to raise this point.
The left likes...
Go ahead.
The left likes to talk about this bogus number of 45,000 people dying because they lack health insurance. The Institute of Medicine says that 50 to 100,000 patients die every year because of medical errors. The #1 contributor to medical errors in the country is the Medicare program that Erica thinks is so efficient.
So what's the answer? I mean, what is the answer? There are a lot of people out there who are watching this and saying, my insurance premiums have gone up. My coverage has gone down. I don't like the government plan either.
Mandates.
How do we get, I mean, isn't the answer overall that we need to somehow get costs down, costs back in line? How do we do that?
One size fits all doesn't work. These governments, Erica, you are right about Michigan. Guess what? They mandate everything. They tell these insurance companies that you have to have these full Cadillac insurance policies. There is no bloody choice in this system because all these state governments are meddling. And what Obamacare is going to do is make the state government meddling nationwide. Do you understand? There's no real choice. That's why the costs continue to rise. If you put choice into the system, Erica, you'll have a much more efficient, real free market competition.
Right now, 99% of the markets in this country are essentially monopolies. And so the people who are making the decisions for 99%.
And don't you see, Eric, I agree with you on that point, and here's where I'm going with you. I want interstate competition for insurance, and I want the government to get out of mandating insurance policies. That's what I'm saying.
There is no doubt.
Make it real competition.
Wait,
I agree with you.
I can't believe we're all agreeing. Michael, do you agree with this? We're going to all agree, and then we're going to go to a
We all
commercial
agree
break.
that more competition can potentially be a great thing. The question is, how are you going to get to more competition?
Michael, go ahead.
The main problem with America's healthcare sector is that the wrong people control the money. The government controls half of the money. They delegate another quarter of the money, that control over that quarter, to employers, and so consumers don't have any incentive to economize because the savings don't go to them. They go to an employer or they go to the government. We need to let consumers control their own healthcare dollars, and they will wring inefficiency out of the system.
That's it. We all agree. Thanks to both of you for joining us. I think
on my daughter's 6th birthday, I was sitting at my desk when out of the blue, I got a really intense pain in the middle of my stomach. My small intestine had twisted on itself. Everything below the place of the twist lost blood flow. I ended up having 10 feet of my small intestine removed. I had a really bad abdominal infection. So I ended up being in and out of the hospital for a couple of months. When I came home, I started to receive bills from my insurance company, and my total bill ended up being several $100,000, of which almost half was not covered by my plan. After spending hundreds of hours on the phone, not getting a straight answer, I was just like, this is not fair. This has got to stop. So I vowed that I was going to fix this. I vowed that I would make it better. The good thing about being an American is that we are wired to not accept things that don't fulfill our expectations. The general public decides that they don't like the status quo, and they do something about it. And it's why I think Silicon Valley can really only exist in a place like the United States. I think what's exciting about this new wave of companies in the Valley is that they're really bringing the power of the web, the power of networks, the power of data, the power of customer service experience, the power of great design to the physical world in a way that was unlike anything that we've seen before. I don't really think of myself as a member of some swashbuckling coterie of entrepreneurs. I just view myself as one actor that's trying to fix what I think is a very in need of fixing part of our economy. I think it was just a matter of time before health insurance had its reckoning or had its moment. For me, obviously, it's very personal. I felt like I was getting incredible care, but the experience of how to pay for it and understand what I was paying for felt decidedly different. That was the driving force for collective health. When I was researching the health insurance industry, I discovered this phenomenon of self-insurance.
Usually people think of their health insurance as coming from the logo on an ID card. But in many cases, larger employers, especially those with 1,000 employees or more, turn to self-insuring their health plans, which means they're the ones footing the bill and taking on the entirety of the risk of covering their employees' healthcare costs. Essentially, they become mini health insurance companies. Companies do this in order to better tailor their health benefits to the unique needs of their people. So for example, they could offer a fertility or a behavioral health program that might meet the specific needs of their population in a way that traditional health plans don't. Under this model, the incentives are really well aligned because at the end of the day, employers care about having healthy, productive workers, but they also need to do it in a financially responsible way. Self-insured employers, therefore, are in a position to drive the kind of change we want to see in the healthcare system because they're far more accountable for spending their money wisely. Collective Health was designed specifically for them to make it much easier and much more transparent to manage their healthcare investment.
But it's not an easy thing to do. What we do is a lot like an iceberg. There's obviously engineering and operations and design and product, but there's also customer service and customer support and legal and compliance. And so the minimum viable product that we have to build as a startup is really, really large and unlike anyone that I've worked on before, especially at this stage. We sit at this nexus of people's health and people's money, and honestly, you can't sort of mess with either. People are very, very, very anxious. I mean, healthcare costs are the #1 cause of personal bankruptcy in this country by a pretty wide margin.
If you go out there and you surveyed Americans, what's a copay, what's a coinsurance, what's a deductible, and what's an out-of-pocket max, only 14% of people could answer just one of those questions correctly. So what we're working to do is to radically simplify the benefit design and plans and the way those plans are presented so that they can actually make sense to people.
Fixing health insurance is a huge problem. It's daunting, it's scary, but that's also what makes it motivating. People aren't motivated by easy challenges. They're motivated by the gnarliest, hairiest challenges out there. Everyone, without exception here, has had some experience that's made them personally very motivated to make the industry a lot better than it is today. You're not thinking about yourself or your own individual sort of accomplishment. You're thinking about this issue that's bigger than any individual one of us. Entrepreneurship is not easy. But for those of us who are unsatisfied with the way things are, I don't think there's a better way of expressing that kind of protest. I think working on something that has meaning in the way that what we're doing does definitely makes me feel good, because I can go home and tell my kids, look, I'm trying to fix a system that touches each and every one of us.
I'm really proud that he has taken this as, a fight that he wants to fight, and has gathered amazing people around him to help him do that. And hopefully, other families won't have to go through what we went through.
What does Daddy do?
What does Daddy do?
As a job.
He works on health insurance. He makes people healthy. He works on health insurance.
People are frustrated and want change. We're just very happy to be able to deliver on that change.
There are a lot of personal stories being told tonight, and I'm glad to say that I have health insurance. And the idea of increased wait times for a medical procedure that terrifies me. But then I think about the 15% of America who have no insurance, and how long are their wait times? So basically, like, what I can't wrap my brain around is, how can a system based on companies that make a profit on denying our care be made responsible for paying for our care?
John Stossel.
Well, you're right. The insurance companies have a conflict, and the insurance company has to balance. They want to pay for nothing. They hope none of you ever get sick, and if you get sick, they don't want to pay. But of course, if they do that, word gets out, and they don't get any new customers. So that's how they have to balance that. That's how all businesses balance that. And
or they wouldn't if you were able to choose your insurance company.
That's the other problem, that you have to buy insurance here in New York from a New York insurance company. And because the politicians, always wanting to give you more, have loaded it up with all these extra guarantees. You must pay for Viagra and in vitro fertilization and acupuncture, or hypnosis, or pastoral counseling. I forget what's all on the list of mandates. You're not allowed to buy from Wisconsin, where insurance costs a fourth as much.
The reason you have to buy from a New York insurance company is because New York has community rating, which means that an insurance company cannot turn you down if you have a pre-existing condition. And if they throw it open across the country, then people who don't have a pre-existing condition, people who are healthy, can go shopping, and it's not some kind of crazy thing because they want people to have hypnosis. It's because they're trying to protect people who would not otherwise be able to get insurance, and that gets at the irresponsibility of the arguments that are made.
Thank you,
so
Paul Krugman.
often
Art Kellerman. Michael Cannon against the motion.
Professor Krugman mentioned that community rating laws like you have here in New York are intended to help the sick obtain health insurance. The leading researcher in the country on insurance markets, specifically the individual market where you buy insurance directly, is a man named Mark Paul. He's at the University of Pennsylvania. And what he's found after researching what actually happens in insurance markets is he's found that those laws reduce, the community rating laws that Professor Krugman favors, reduce the number of people with health insurance, and they don't provide health insurance to many more sick people. And the reason is that that unregulated markets really do a remarkably good job of providing health insurance to people with expensive chronic conditions, provided they purchase health insurance while they're still healthy. So these regulations... And it's expensive and difficult to do, but you cannot have an insurance market unless people do that, because no one will buy insurance until they need it. No, you can't have a homeowner's insurance market if people can buy coverage after their house burns down. That is the market's way of encouraging people to do the right thing and pay into the pool while they're still healthy.
Under Medicare for All, you either take private insurance away from those 170 million Americans or greatly restrict access to it, meaning there is no relief valve for physicians facing up to 40% payment cuts. This would decimate physician networks, creating a permanent physician shortage, and it would leave medical students with no hope of paying off their loans. And the cost of Medicare for All has been projected to be as high as $32 trillion. That's trillion with a T. Basically, if implemented by 2022, Medicare for All would mean that healthcare spending would take up 58% of federal spending, compared to 28% today. It's fiscally unsustainable. But to make matters worse, it would destroy Medicare for the seniors who have spent their whole life paying into it. A promise made to those who paid for it would become an entitlement for all, destroying an important program for those it was intended for. Medical innovation would take a back seat, and we would give up our status as the world's leader in medical innovation. Imagine placing every American under a system where an act of Congress is required to add benefits or to make routine changes. Healthcare is changing rapidly, and we need to have a system that is nimble to respond to it. The reason people are calling for Medicare for All is not because the ACA has worked in remedying what ails our system, because it has not. But their solution is literally to do more of what's not working. It's like the man who has a pounding headache, who then takes a hammer to his head to make it go away.
Part of the problem, and we haven't really talked about it, and I have a lot of sympathy and empathy with the idea that insurers here are part of the problem, not because they seek profit, but because they're able to mask a lot of behavior and because they're able to structure a lot of regulation that keeps competition out. Same thing with cartels in general, with all due respect to Adam. You know, the medical cartel, like, why don't we have more medical schools than we used to, than we had, 25 years ago or 30 years ago? Why don't we have more doctors and nurses? Why haven't we changed the way that we certify things and allow medical care to be delivered? It's a big deal, just to get urgent care places put in and around New York, which are becoming a thing now. That took forever. We don't have a free market in healthcare, and that is not something that we should, double and triple down on. That's something we should get rid of and bring in more market forces.
That concludes round 2 of this Intelligence Squared U.S. debate, where our resolution is replace private insurance with Medicare for all.
And summing up against the proposition, Michael Cannon, co-author of Healthy Competition, What's Holding Back Healthcare and How to Free It. He is the Cato Institute's Director of Health Policy Studies. Michael?
At the reception before we came in here, I was standing across from a man who was reading his program, and when he came to the part with my picture on it, he looked at the picture, he looked up at me, and he said, "Hey, that's you." And I said, "Yes, that's me." And he said, "You're against universal coverage?" Because I think, and this look came over his face, the question that was forming was something like, what kind of a moral reprobate could be against universal health insurance coverage? And I know that I have a lot of family here tonight who are asking themselves the same question. My opposition stems from 2 beliefs. One is that people should have the right to choose their doctor, they should have the right to choose their health plan, and those things are often lost in systems of universal coverage, almost uniformly. No, I think totally lost. And second, universal coverage is not going to make us healthier. We have serious problems here in the United States with rising costs, with low quality care, and we have health plans in the private sector that are trying to innovate with ways to reduce those costs and to improve the quality of care. The only problem is you can't choose them because the government has said you can't. The only problem is that the government controls half of the money in our healthcare sector. And so the industry is able to block those innovations because they want to protect their incomes. You can have a healthcare sector that guarantees universal coverage, or you can have a healthcare sector that continuously makes medical care better, cheaper, and safer, making it easier to deliver on that moral obligation that we have to help the less fortunate among us. You cannot have both.
Thank you, Michael Cannon.
Let me ask you about some of the ideas, the alternatives that are being floated out there and apparently gaining some measure of traction. This idea of state-based nonprofit healthcare cooperatives. Senator Conrad has pushed this idea. Apparently, again, the Senate Finance Committee is giving this strong consideration. The president hasn't necessarily ruled it out. Would it work?
Well, if co-ops were constructed in a way that allowed for state regulation as opposed to federal regulation, if the federal government wasn't in the position of appointing all of those who would govern them, if it could become real capital that's being deployed in a way that would provide competition. I don't particularly understand the difference between a co-op and, say, a nonprofit Blue Cross plan, but it has possibilities, but it really boils down to whether or not the federal government is going to operate it, capitalize it, and control it. If it does, it ends up in the same place as Medicare for all. One of the things that I think providers need to be concerned about is whether or not Medicare reimbursement plans are being used. If it is, I think that's a big problem for hospitals. It's a big problem for doctors, and ultimately they'll come to that conclusion.